theme of the International Nurses Day for the year 2022. So we all know that Nurses Day is celebrated every year on 12th May. 12th May is actually the birthday of Florence Nightingale, one of our pioneer in our nursing profession, who is celebrated as the lady with a lamp. So every year actually we have a theme which is actually given by International Council of Nurses. So this International Nurses Day was first celebrated in 1965 by ICN. Today, ICN, that is International Council of Nurses, they represent more than 27 million nurses worldwide. And every year, ICN, they promote and they distribute something called as IND kit or IND resources. Okay, so which is actually taken up by all the all the countries in order to celebrate the Nurses Day with that particular theme. So this year, the theme for International Nurses Day is Nurses, a Voice to Lead. Invest in nursing and respect rights to secure global health. So that is actually the theme for this year. That is nurses a voice to lead, invest in nursing and respect the right in order to secure global health. So every year, as I told you, the theme is being given by ICN. So over the past few years, we find that the theme is the same. Like for example, from the year 2017, if you see the main theme of the Nurses Day is Nurses a Voice to Lead. So in 17 it was Nurses a Voice to Lead, and the sub theme was Achieving the Sustainable Development Goals. In 2018, the sub theme was Health is a Human Right. 2019, Nurses a Voice to Lead, Health for All. In 2020, it was Nurses a Voice to Lead, Nursing the World to Health. And in the last year, that is 2021, it was Nurses a Voice to Lead, a Vision for Future Healthcare. So this year, we find that over the past 5 years, if you're going to see, the main theme is the same, Nurses a Voice to Lead. But the sub-theme for this year is invest in nursing and respect the rights in order to secure global health. So let us have a detailed version of what ICN is trying to tell us with the sub-theme of invest in nursing and respect rights in order to secure global health. So ICN comments that there is a need to protect, support, and invest in nursing profession in order to strengthen the health systems around the world. So this year we are going to focus in such a way that there is a need in order to not only invest, but number one is to protect nursing profession, support nursing profession, and then invest in nursing profession, because only when nursing profession is going to be strengthened, it is going to indirectly strengthen the healthcare system around the world. So this time, this ICN has brought out in the toolkit three posters. Number one, poster number one is there, two is there, and three is there. So quickly we are going to look at the pictures which is given by ICN in the toolkit with the three posters. So this is poster number one, which is being given by the International Council of Nurses. So we find that there is a nurse, but she's not so happy. Okay, she is in her uh, sterile gown, draping, all those things, but she's not so happy. We find when we zoom the picture, we find that there is a mark, there is a red mark above the eyebrow near to the nasal bridge, and she's not so happy. Maybe this is actually portraying the picture what nurses have really struggled, especially taking care of a lot of patients during the COVID period. So wearing all the PPE kit, working for long hours, continuously without any rest, and continuous use of goggles, continuous use of all the PPE kits, making a lot of, you find a lot of marks over the face of a nurse, and she is so tired and she's not so happy. So this is the first poster which is being released by ICN. And this is the second poster. You find that in the second poster, a nurse is actively, she is actively involved in taking care of a patient. I'm not sure, maybe it is an emergency department and there is something which has to be done. Emergency care has to be given for the patient, and she is actively involved in taking up the leadership and maybe to provide care to the patient. This is poster number 3, where again we find nurses getting ready in order to wear a PPE kit. So these are the 3 posters where nurses are shown in action, taking care of the patient, getting ready, and maybe you find that nurses are the first poster. We find that a nurse is not so happy, maybe she is highly tired, there is a lot of things that has to be done in order to promote the health of nurses. So all the 3 posters are conveying towards the sub theme, reminding the world that investment has to be done in the profession of nursing, and we have to respect the rights of the nurses in order to secure global health. Personally, I feel really happy that ICN has come out with such a theme, with such a sub theme, telling or reminding the world to invest in the nursing profession, because were running around, nurses are still running around taking care of numerous patients when all the other professions were going into the shell or getting into the protection of a shell. It was only the healthcare system who were running around, especially nurses who were providing continuous round the clock care to the affected patients. So ICN has rightly brought the sub theme out, telling that to invest in nursing and to respect their rights in order to secure global health. ICN has launched, this is another wonderful thing which we see given by the International Council of Nurses, where they have launched a compilation of case studies which are submitted by nurses across the world. And this compilation of case studies is available in the website. When you go to ICN's website, you have a thing like compilation of case studies. When you click onto that, you find that numerous case studies are there which are being submitted by nurses across the world, and that case studies are actually showing us the incredible range of innovative work nurses do every day. So from all over the world, we find case studies which is going to reflect or illuminate how nurses are really taking care of patients innovatively, how they do their work every day. And these stories are highlighted in the ICN website, in the IND website, International Nurses Day website throughout the year. And it reflects the work of nurses, especially those who care for patients with COVID throughout the pandemic, as well as, not only COVID, but also wide variety of diseases, how they take care of patients, especially who are suffering from multiple conditions throughout the world. Now, from that particular website, okay, so this is how it appears when you click on to that compilation of case studies. These are the table of contents which is given by National Nursing Association or country. And you find that starting from Australia till Vietnam, you find that so many case studies are being submitted. And being an Indian, I find that in page number 17, okay, you find that the case study submitted from India has been highlighted. So I would just like to take you to a glimpse of the case study that was submitted by Indian nurses to this particular program. So from India, the topic was diabetic foot care, stepping ahead. So the case study which was submitted was not related to COVID, it was related to diabetes foot care, stepping ahead. And the contributor is Prabhat Kalkur. So, briefly, when I look into the case study that is being submitted from India, these are the highlights of that, where the author says that 69.2 million adults in India are approximately suffering from diabetes mellitus, and nearly 50,000 people they lose their feet every year, because of diabetics foot due to diabetes. And nurses they play a very important role in prevention of diabetic foot problems and in the care and education of patients who are at risk for developing foot problems due to diabetes. So what did they do in the study? So in the case study, what they have reported is they took a multifaceted approach, which was titled as diabetic foot care, stepping ahead. So that was adopted, and the main focus was to improve or to increase the quality of food care and to improve the quality of care to in order to support the affected families. So the project, how did they do the study? The project included capacity building training. So whom did they train? They trained different levels of health professionals. What did they do? Mobilization of creating awareness, lifestyle modifications, communication, establishing diabetic food clinics and research into diabetic food care. So it was a multifaceted approach where training was being done to multiple level of health professionals in order to create awareness, in order to provide lifestyle modifications, and in order to establish diabetes food clinics. And this particular project was supported by World Diabetes Foundation, and actually it was Manipal College of Health Professionals and Kasturba Hospital Manipal Academy of Higher Education was the principal recipient of the project. So the project was undertaken in India, in Karnataka. Okay, and Manipal Academy of Higher Education was the principal recipient of the project. So they incorporated Betty Newman's system model of nursing into the delivery model, and the highlight was that the project manager was a nurse. Okay, so it was the overall thing was by a nurse, and the principal investigator, senior health educator, and clinician were physiotherapists. So the campaign, what did they do? They had a lot of camps for awareness and screening where people with diabetes, people who are at risk for diabetes, were provided food care at primary level, and complicated cases were referred to appropriate services. In addition, they also used a mobile unit in order to handle all the food care services in more remote areas so that they can cover a lot of people, okay, especially in rural areas. So what was the final outcome of the project, which was done in India? The project trained 358 nurses and 175 physiotherapists. In addition, more than 11,000 people were screened for diabetic foot complications, and over 1,13,000 were screened for diabetes mellitus. So, thus, this project reached over a million people through the media, raising awareness of the prevalent disease, that is diabetes complication. So this is the study which has been highlighted in the IND website, okay, especially that is the famous case studies from each country. So from our country, India, this is a project which has been highlighted where so many people were trained how to take care of, how to screen for diabetes, how to prevent complications related to diabetes foot care or diabetes foot. And in addition, so many people, nearly 11,000 people getting screened for diabetic foot, and 1,13,000 people being screened for diabetes mellitus is really a wonderful outcome study which has been submitted from our side, that is from India. So, like this, if you're going to see from each and every country around the world, we find so many case studies which are being, uploaded in this particular website, which actually talks clearly the contribution of nurses in making a change in this world by providing primary, secondary, and tertiary level of care. So, International Council of Nurses comments that from birth till death, non-communicable diseases to infectious diseases, mental health to chronic conditions, hospital level, community level, home nurses level, in everywhere, if you're going to see, let it be birth, let it be death, let it be communicable, let it be non-communicable, let it be mental health, let it be chronic health, let it be a primary health center or a home nurse or a community or a hospital. Nurses provide accessible care to all, affordable care, person centered, and holistic care for all. So, that is the image of nursing today, where we find nurses at all levels providing accessible, affordable, person centered, and holistic care for all the patients. In addition, ICN reminds that COVID-19 has exposed weaknesses caused by underinvestment in health systems around the world. Now that we have we have experienced what is COVID-19 pandemic. All of us will agree 100% that yes, COVID-19 has exposed weakness, because we find that when COVID-19, it started to spread around the world, we came to realize that there was shortage of staff nurses. Nurses are needed everywhere. There was paucity of shortage or paucity of nurses. There is paucity of the infrastructure, paucity of the needed supplies. So we understood that there we have to strengthen the health system, because we realize that there is underinvestment in health system, and COVID-19 has exposed and taught us that we are yet to develop, or we are yet to strengthen with respect to health system. So this theme demonstrates that we have to invest in nursing. Why? In order to build a highly qualified, a highly resilient workforce, and in order to protect nurses' rights, so that the health system will get transformed in order to meet the needs of not only the individuals but also the communities, not only for now but also for the future. So this theme is actually reminding us that we have to invest in nursing. We have to invest in this profession of nursing, so that the nursing workforce is going to become a strong workforce, a highly resilient workforce, a highly qualified nursing workforce who are competent in order to take care of the individuals not only now but also in the future. We also find that ICN's president, Dr. Pamela Cipriano, said that nurses have suffered tremendously throughout the pandemic. They have been unnecessarily exposed to the virus. They have faced attacks from the public. They have suffered from extreme workloads, and they continue to be underpaid and undervalued. When I read this, I remember the poster number 1, which ICN has given, where we find a nurse who is actually not so happy. We find her sad, we find her with all the marks on the face, on the forehead, okay, which is actually reminding us that yes, staff nurses have suffered tremendously throughout this COVID pandemic. They have been exposed to the virus. We have lost many valuable nurses because they have taken care of patients with COVID-19. They have surrendered their lives to COVID. They have faced attacks from the public. We still remember how the public used to isolate nurses, especially who were taking care of COVID-19 patients due to fear of contracting that particular disease. So, attacks from the public, extreme workload where the available nurses were actually overworked. They were asked to continuously give care for the patients with very less rest in between. Extreme workload. And in addition to all these things, they were continued to be underpaid and even undervalued. So the ICN president says if government is going to continue to put off investing in health workforce, it is going to be detriment of health system everywhere. So she is reminding that the government has to take initiative in order to invest in this particular health workforce, especially nursing. If that is not going to be done, it is going to be dangerous to the health system everywhere around the globe, because she reminds us that there is no health without a health workforce, without especially nurses. So, this year's IND theme for 2022 is continuing to promote nursing work in order to fight for the rights of nurses, for establishing a safe and a working environment, safe working environment, to have fair wages, decent wages, and for full participation in decision making. So, this is what this year's theme is focusing on, that is to promote nursing, to invest in nursing, to fight for the rights of nurses in order to have a safe working environment, in order to have a decent wage, and in order to participate fully in decision making. So, that is about the theme of this year, where we are reminded that it is going to be nurses a voice to lead, but to invest in nursing profession, in order to invest in the profession of nursing, and in order to secure the rights, in order to respect and secure the rights of nurses. This is what the theme for 2022 is. So I hope this small video has helped you to get at least a small idea on what is the theme of International Nurses Day for the year 2022. When we remember the three posters, we are able to understand that yes, something has to be done in order to invest in the profession of nursing, in order to help them to have a secure workforce, in order to have a qualified nursing workforce, competent nursing workforce, so that we will be able to take care of the individuals not only now but also for the future. So I wish you all a very happy Nurses Day, and thank you very much for patiently watching my video. Thank you.